Hey guys, welcome back. Today we are going to learn some mnemonics of the subject oral pathology. So before we begin it, hit the subscribe button and the bell icon. Only when you hit the bell icon, you will get the notification of video of my channel. So please click on that and now let's begin. So today we are going to learn about Rubinstein-Taby syndrome, Klinefelter syndrome, Gardner syndrome and Ladd syndrome. So, what is Rubinstein-Taby syndrome? In this syndrome, the patient has broad thumb, talons cusp, developmental retardation, delayed and incomplete descent of testis. Now, the point to remember is that broad thumb and talons cusp is very important for this syndrome. So, how to remember Rubinstein-Taby syndrome? From now onwards, you start spelling Rubinstein-Taby syndrome as Rubinstein-Toey syndrome. Now, you can associate this toe with the broad thumb and broad toes of the patient. In the next slide, I have given some photos, images of the syndrome. So, in the first image, you can see the X-ray of a patient in which he is having broad thumb. In the second image, the patient presents with talons cusp. In the third image, also you can see broad thumb. Now, Klinefelter syndrome, which is also called as trisomy 47. In this, the main and the very important dental anomaly you can see is taurodontium. So, what is taurodontium? I have shown the image of taurodontium in the next slide. And the second very important is double XY genetic contribution. So, the patient is having extra X in his gene. Now, in the next slide, I have shown the images of taurodontia. So, you can see taurodontia is having a bull like teeth. In this slide, we'll see the mnemonic for Klinefelter syndrome. So you can remember this syndrome with its first letter K. Now K, from K, kill the bull, and bull means bull like teeth. So try to remember and revise this mnemonic so that you will retain it for a long time. Okay, so what is Gardner syndrome? In Gardner syndrome, you can see multiple polyposis of large intestine in the patient, osteomas of bone, multiple sebaceous cysts, impacted supernumerary teeth. All these 4 points are very important for Gardner syndrome. Okay, so you can remember Gardner syndrome by this mnemonic. Gardner eats a lot. So this is why he is having intestinal polyps. If you don't want to learn like this, then you can also try a mnemonic. Gardner syndrome topic is very important. So topic T for tumor, which is desmoid tumors. O for osteomas, that is patient will have multiple osteomas. P for polyposis, that is intestinal polyps. I for impacted teeth, which can be supernumerary. C for cyst may be epidermoid, sebaceous. Okay. Now what is Ladd syndrome? Ladd syndrome means it is a mnemonic in itself. L resembles L for lacrimal gland involvement, A for auricles are deformed, D for dental involvement, and another D for digital deformity. So in this, I have put an image of deformed auricles. Now, yes. So, lacrimal involvement involves lacrimal sac inflammation and lacrimal gland aplasia. A A for auricles, which is auricles are deformed, as I've shown in the previous slide. D for peg-shaped teeth, hypodontia, enamel hypoplasia. D means dental involvement. What will what we will see in dental involvement is peg shaped teeth, hypodontia, and enamel hypoplasia. And another D for deviation of fingers medially or laterally, which is also called as clinodactyly.